Hello everybody and welcome back to ARPneuro Therapy. This is the PRS library. My name is Jake. I am your ARPneuro trainer, and in this video we're going to talk about hip pain, pad placements, and movements that you can do to alleviate that hip pain using the PRS device. So first off, what leads to hip pain? So oftentimes when you're experiencing hip pain, you're getting some sort of impingement. Perhaps there's a labral tear. Maybe you're even dealing with bursitis, predominantly trochanteric bursitis, which is near the greater trochanter area. Sometimes it could even involve a weak core, and that will lead to some sort of breakdown where you're experiencing hip pain. And lastly, believe it or not, pelvic floor or a weak area in that region can certainly lead to hip pain. So with this protocol, I'm going to be using the 4-pin lead system. So first you want to take your black lead, and we're going to place the black lead going vertically on glute med. So black on glute med. Next, I'm going to take the red lead, and I'm going to place the red lead on the inside part of your thigh, in your gracilis, it's called. So inside of your thigh, just like that. So red on the inside, black on the outside glute med. Once we have that set up, we're going to go ahead and we're going to mirror everything on the other side. So now that we have all 4 pads placed, we're going to go into the movement portion of this protocol. All right, now that you have all the pad placements on, and just a reminder, I have black right here on glute med, and then I have the red inside right here on the gracilis, inside of your thigh, and I have everything mirrored on the other side. So all 4 pads are on. I'm gonna fire this device up, hold the purple power button, wait for the beep. I wanna get to a point where it's at a pretty close level of like an intensity of a 5 or 6. Now, as we go through the sets, we're gonna continue to push this output power as much as we can tolerate. So I'm gonna just go ahead and place this in the pocket right here. If you notice on our website, we also have a pouch. I show you how to use that, so you feel free to go out there and get a pouch too. It makes it a lot easier to wrap around your waist. Now the first move I'm gonna do, as you can see, I have a chair here. That way I can keep pressure and maintain my balance. So you just wanna hold on to the chair, and we're gonna kick out right here, and then we're gonna kick back. Now notice, I'm not leaning forward to kick back in this case. I wanna get these muscles engaged. I want to feel that activate. I don't want to start leaning forward because that changes what's being activated. So stay here, go as far back as you can, and then to the side. Now, as we're doing this, a full rotation would be going to the side and back. That would count as 1. Now, you want to do 5 to 10 reps of that full cycle. After that cycle, you want to kick up that output power, so turn it up again, and then go through this 4 sets, 5 to 10 reps, on both legs. Once I finish the first set on this leg, I'm gonna switch this, and I'm gonna do the same thing on the other side. So kicking to the side, and then back as far as you can, engaging, making sure that form is good. That standing leg is working as well, so you wanna maintain that form. The best way is to just kind of hold on to that chair and work it this way. Once again, both sides of this, 4 sets, 5 to 10 reps. Now for this next move, you're gonna be on all 4s, and from this position, all we wanna do is we wanna raise that knee to the side, and then bring it down. Raise it to the side, go as far as you can. When you're doing this, you wanna make sure you're not leaning too much to that downward leg. You wanna really open up that hip on that side that's doing all the movements. So with this movement, you wanna do 5 to 10 reps, once again, doing both sides, 4 sets total on each side. In between sets, you want to try to increase that output power each time as much as you can tolerate. So long as your form is good and you're not compensating, you can certainly keep going up with that output power. This final movement is advanced. So if you do struggle with this, you can just work on the first 2 movements and then slowly work your way up to this one. But if you are ready to go to the next level, I highly recommend doing this because it's fantastic for range of motion and trying to increase that range of motion, or at least improve it with your hips. I'm gonna use the chair again, something to hold on to, so I'm not focusing on balance, which will throw off my form. I'm balancing on my right, so I'm gonna hold the right side here. My left, I'm gonna drive that knee up as high as I can, and then watch what I'm doing here. I'm just gonna open that hip as far as I can. From here, I wanna try to keep the knee in place and I'm just rotating that hip as much as possible, and then I'm coming back. And then I'm gonna go the opposite way. So I'm kicking back here, up here, keep good posture, wrap around, use that hip really extended and bring it back. That's considered one sweep. So I'll show you one more time. Up here, open that hip up, keep that knee, really pivot. If you can get a mirror, it's often better because you can watch your form and you can certainly see where my range struggles. And I'm gonna do another sweep back here. Watch that posture, rotate up and around and down. So once again, 5 to 10 reps, 4 sets on both sides, increasing that output power as much as you can tolerate. Once you're ready to take it off the muscle contractions, I do recommend you use the main pulse suspend feature just to keep blood flow going and generating in that area. So you want to hit main pulse suspend and then power that up all the way to the top. And then once it's on main pulse suspend, you want to leave it on for a minimum of 30 minutes, but if you can leave it on longer, that's even better because now you're generating more blood flow into that area of pain, helping your recovery process. So there are the pad placements and movements that you can do if you are experiencing hip pain. Also, if there is a video that you do not see in the PRS library, feel free to reach out to us at info@arpneuro.com so we can put it on our list, and eventually we will have it out there for you on what you can do. Thanks for watching, and this is your hip protocol using the PRS device.